name's Rush. I'm a nurse practitioner here at Stanford's otolaryngology department. Today I'm going to talk to you about how to stop a nosebleed. The medical term for nosebleed is epistaxis. There are three common areas of epistaxis in our nose: the front of the nose, the back of the nose, and along the turbinates, which are bony growths that grow from cheek to nose on either side of our nose. When there's a trauma, like when we're picking our nose or aggressively rinsing our nose or a lot of dust or pollen, it's very common for the front of the nose to start to bleed. And that's because there are three arteries that kind of merge together right at the tip of the nose, and they're underneath a very thin layer of mucosa. It's the first area that this dust or cold or a finger can kind of go and irritate the mucosa, and if that happens, the nose can start to bleed. Sometimes after surgery, the back of the nose can bleed just because we've gone in there and kind of irritated the nose. If your nose starts to bleed because you have blown your nose too hard, maybe first thing in the morning after rinsing, or you picked your nose and it's just started to bleed, or maybe even something hit it gently and then it started to bleed, the best thing to do is to look down at your toes, pinch the soft part of your nostril hard enough where you won't be able to breathe through your nose, and hold your position like that for about 10 minutes, like this. Pinch the nose and look down at your toes. And you want to hold your position like this for 10 minutes. You can hold that position for 10 minutes and then let go. If the nosebleed continues, you can repeat it up to 3 times in 1 hour. If the nosebleed has not stopped after 1 hour, please give us a call. You don't want to look up when you have a nosebleed, because that will cause the blood from the front of the nose to drip down into your throat, potentially having you swallow the blood or causing the blood to clot around your airway. It's okay if you swallow a little bit of blood, but the nausea sensation that you might feel because of the iron content can cause you to actually throw up, which further puts pressure onto the face, into the nose, causing more nosebleeds to happen. You also don't want to pinch the top of the nose where it's a little bit more strong, because that's not going to stop the nosebleed at all. You can kind of think of it when you have a scratch on your hand. You want to put pressure on that scratch to stop the bleeding. The same thing for the nose. You want to put pressure where the bleeding is coming from to stop the bleeding. You also don't want to use ice packs to stop the bleeding unless you have swelling. Ice will not stop the bleeding. It will only help with the swelling that may have occurred if you've had a trauma to your nose, like a ball or a fall or something like that. Thank you for watching. My name's Rush, and I'm from Stanford Otolaryngology Department.